Blackheads are one of the most common skin concerns in the world, and they can feel frustrating because they tend to return even after you remove them. The reassuring truth is that blackheads are usually very preventable when you understand what they are, why they form, and how to build a routine that keeps pores functioning normally without irritating your skin. This educational guide is general information, not a personal diagnosis. Skin is individual, and if your acne is severe, painful, scarring, rapidly worsening, or not improving with gentle over-the-counter care, it is worth speaking with a licensed dermatologist for a tailored plan. With that said, most people can see meaningful improvements in blackheads with a consistent, calm approach that supports the skin barrier and uses a few proven strategies. A blackhead is what we call an open come done. Inside each pore, your sebaceous gland produces oil, also known as sebum. Your skin cells naturally shed as part of normal turnover. When oil and dead skin cells combine in a pore, they can form a small plug. If that plug is near the surface and the pore opening remains open, the top portion is exposed to oxygen and appears dark. That dark color is not dirt. It is primarily oxidized material and pigment changes in the plug itself. This matters because it changes what works. If you treat blackheads like dirt, you will be tempted to scrub aggressively, use harsh soaps, or strip your skin with alcohol toners. Those approaches often backfire, because irritation and barrier damage can increase oil rebound, trigger uneven shedding, and make pores clog more easily. Blackheads form for a few main reasons. Your skin produces enough oil to mix with shed cells, the pore lining becomes sticky so cells do not shed evenly, product films or occlusion trap oil in cells in place, and inflammation or barrier disruption makes the pore environment unstable. Genetics play a role, hormones play a role, climate plays a role, and skincare choices play a role. The goal is not to fight your skin. The goal is to normalize how your pores shed and drain, reduce the conditions that create sticky plugs, and keep your barrier strong so your skin is resilient and calm. Calm skin is predictable skin, and predictable skin responds best to prevention routines. When people struggle with blackheads, I usually see one of two patterns. The first pattern is undertreatment. They cleanse, maybe they use a scrub, but they never use ingredients that work inside the pore lining, so plugs keep reforming. The second pattern is overtreatment. They use too many strong products too frequently, the skin becomes irritated and dehydrated, and then they end up with a face that feels tight but looks oily, with persistent clogged pores. Overtreatment can also lead to stinging, redness, peeling, and a cycle of starting and stopping products that never allows the skin to stabilize. Prevention works best when your plan is simple, consistent, and balanced. I like to explain blackhead prevention as 4 pillars that work together: gentle cleansing, targeted pore care, barrier support, and daily sun protection. You do not need a complicated routine. In fact, too many steps often makes acne worse. You need a routine that you can repeat even on busy days, without irritation, and long enough to see real change. Let's begin with gentle cleansing, because cleansing is what removes sweat, excess oil, pollution, and, most importantly, product films that can trap material in pores. A cleanser should leave your skin comfortable after you rinse. If your face feels squeaky, tight, or stings, that cleanser is likely too harsh or your cleansing routine is too aggressive. Hot water can also make skin dry and reactive, so use lukewarm water. Massage the cleanser over the skin for about 20 to 30 seconds, focusing on areas where blackheads tend to appear, such as the nose, chin, and forehead, then rinse thoroughly and pat dry. Avoid scrubbing with rough cloths or brushes, because friction increases irritation and can worsen inflammation around pores. For most people, cleansing twice daily is sufficient, once in the morning and once at night. If you have very dry or sensitive skin, you may do better with a simple water rinse in the morning and a full cleanse at night. Your night cleanse is the most important. If you wear sunscreen, makeup, primer, or long-wear products, a single quick cleanse may not remove the film fully. When product films remain, they can mix with oil and dead cells and increase the chance of clogging. In those cases, many people benefit from a gentle double cleanse at night. The first step can be an oil cleanser, balm cleanser, or micellar water to dissolve sunscreen and makeup. The second step is a gentle water-based cleanser to remove residue. The goal is not to be harsh, it is to be thorough while staying gentle. If you use micellar water, it is often helpful to rinse afterwards so surfactants do not remain on the skin. Now let's move into targeted pore care, which is the heart of prevention. Cleansing removes material from the surface, but blackheads form inside the pore lining. To prevent plugs from forming, you need ingredients that help pores shed normally and reduce the stickiness of dead cells. The most consistently helpful over-the-counter ingredient for blackheads is salicylic acid, often labeled as BHA, or beta-hydroxy acid. Salicylic acid is oil-soluble, which helps it work in the pore environment. It can loosen the mix of oil and dead cells that creates plugs and can help prevent new clogs from forming. If you are new to salicylic acid, start slowly. This is one of the most important points in this entire guide. People often fail because they begin using a strong product daily immediately, then they develop dryness and irritation and quit. Prevention is about consistency, not intensity. Start with a leave-on salicylic acid product 2 nights per week. Leave-on means a toner, serum, or gel that stays on the skin rather than being rinsed off. Some people use a salicylic acid cleanser, and it can help a little, but leave-on products usually work better because they stay in contact with the pore lining longer. After 2 to 3 weeks, if your skin feels comfortable, meaning minimal dryness, no burning, no persistent redness, you can increase to 3 nights per week. Oily, resilient skin may tolerate more frequent use, but more is not automatically better. The best schedule is the one your skin can tolerate consistently. Another highly effective category for preventing clogged pores is topical retinoids. Retinoids help regulate skin cell turnover and reduce the tendency for the pore lining to form sticky plugs. Over time, they can reduce comedones and improve overall texture. Retinoids can be irritating in the first weeks, so a slow introduction is essential. If you choose to use a retinoid, start 1 night per week for the first 2 weeks, then increase to 2 nights per week if your skin tolerates it. Use a small amount, a pea-sized amount for the entire face. Applying more does not speed results, it usually increases irritation. If you have sensitive skin, a method called the moisturizer sandwich can help. You apply moisturizer first, then the retinoid, then another thin layer of moisturizer. This can reduce dryness and help your skin adapt. There is an important safety note with retinoids. If you are pregnant, trying to become pregnant, or breastfeeding, you should avoid retinoids unless your personal clinician specifically instructs you otherwise. If that applies to you, focus on gentle cleansing, barrier support, daily sunscreen, and consider discussing other safe options with a professional. Safety always comes first. Do you need both salicylic acid and a retinoid? Not necessarily, especially at the beginning. Many people do best by alternating. For example, you might use salicylic acid 2 nights per week and a retinoid 1 or 2 different nights per week, and keep the remaining nights as rest nights with only cleansing and moisturizing. Rest nights are not wasted. They maintain barrier strength and keep your routine sustainable. If you try to stack multiple strong actives on the same night before your skin is ready, irritation rises and blackheads often worsen. Barrier support is the pillar that makes prevention work long-term. Your skin barrier is the outer protective layer that holds moisture in and keeps irritants out. When the barrier is compromised, skin becomes more reactive. Products sting, redness increases, and the skin can become dehydrated. Dehydrated skin often sheds unevenly, and that uneven shedding can mix with oil to clog pores. This is why moisturizer matters even if you have oily skin. Many people with oily or blackhead-prone skin skip moisturizer because they fear it will clog them. In reality, the right moisturizer reduces irritation, supports normal shedding, and improves tolerance to actives. The key is choosing a texture that matches your skin. If you are oily, choose a lightweight gel cream or lotion. If you are dry, choose a richer cream. If you are sensitive, choose a formula that feels soothing and does not sting. Apply moisturizer after cleansing and after your leave-on treatment has absorbed. If your skin feels tight at any point, that is a sign to increase barrier support, not to scrub harder. Daily sun protection is often overlooked in acne routines, but it is essential for long-term skin health and for maintaining a stable barrier. Sun exposure can worsen inflammation, make skin more reactive, and deepen the appearance of post-breakout discoloration. If you are using salicylic acid or retinoids, sunscreen becomes even more important because your skin may be more sensitive to sunlight. Choose a sunscreen you will actually wear daily. If a sunscreen feels heavy or seems to trigger congestion, try different formulas rather than abandoning sunscreen. The best sunscreen is the one you apply consistently in an adequate amount. Apply it every morning as your final step, and reapply if you are outdoors for extended periods. Now let's put these pillars into a simple daily routine that you can repeat without confusion. In the morning, keep it calm. Cleanse gently or rinse with water if you are dry. Apply a light moisturizer if needed. Apply sunscreen. That's it. In the evening, cleanse thoroughly, especially if you wore sunscreen or makeup. Then, on the nights you use an active, apply either a leave-on salicylic acid product or a retinoid, not both at first. Then moisturize. On non-active nights, cleanse and moisturize only. This routine sounds simple, but it works because it targets the real mechanism of blackheads while keeping the barrier calm. A common question is how long prevention takes to show results. Expect gradual improvement over 6 to 12 weeks, sometimes longer. Blackheads do not form overnight, and they rarely disappear overnight. Your pores are constantly producing oil and shedding cells, so prevention is about changing the pattern over time. If you switch products every week, you will not see consistent results and you will not know what helped. Choose a plan, introduce changes slowly, and measure progress over weeks. Now let's address some frequent myths and mistakes that keep blackheads returning. One myth is that blackheads come from poor hygiene and need harsh cleansing. Blackheads are not a sign that you are dirty. They are a sign that pores are clogging. Another myth is that burning or stinging means a product is working. Burning is irritation. Effective skincare should feel mostly boring. Mild dryness during adjustment can happen, but sharp stinging or persistent redness is a sign to reduce frequency and increase moisturizer. Another myth is that you should use aggressive scrubs or rough exfoliating tools. Physical scrubs and harsh brushes often cause microirritation and worsen inflammation. If you are using salicylic acid or a retinoid, you generally do not need a scrub. Another myth is that pore strips solve blackheads. Pore strips may remove surface material temporarily, but they do not change the underlying tendency to clog, and frequent use can irritate the skin and make pores look more obvious. Another common mistake is squeezing and digging at home. Extraction can be helpful when done professionally, but at home, squeezing often inflames the pore lining, can cause broken capillaries on the nose, can lead to scabs and discoloration, and can whiten the look of pores over time. It is also important to understand the difference between blackheads and sebaceous filaments. Sebaceous filaments are normal, tiny collections of oil within pores, especially on the nose. They can look like small gray dots and refill quickly because they are part of normal oil flow. Blackheads are more distinct plugs that often appear darker. The same routine can improve both, but sebaceous filaments may never disappear completely, and that is normal. If you chase a perfectly poreless nose, you may overtreat and end up with irritated, shiny skin that makes pores look more noticeable. Realistic goals are calmer pores, fewer plugs, and smoother texture. Now let's discuss the hidden triggers outside of your skincare routine. Hair products are a major one. Pomades, oils, heavy conditioners, and styling creams can migrate onto the forehead, temples, and hairline. If you notice blackheads or bumps there, keep hair products away from facial skin, wash the hairline after styling, and consider cleansing the forehead after heavy sweating. Makeup and sunscreen textures matter too. Heavy primers and long-wear foundations can form films that require thorough removal at night. If you wear makeup regularly, clean your brushes and sponges often, because product and oil buildup on tools can irritate skin. Also consider how many layers you apply. Layering multiple heavy products can increase occlusion and trap oil. Friction and occlusion are another common trigger. Masks, helmet straps, chin straps, and anything that traps heat and rubs the skin can contribute to clogged pores and irritation, sometimes called masking. If you wear a mask for long periods, cleanse gently after extended wear when possible, use a light moisturizer to reduce friction, and avoid heavy, occlusive layers under the mask. Changing masks regularly and choosing breathable materials can help reduce moisture buildup. After exercise, rinse or cleanse sooner rather than letting sweat and products sit on the skin for hours. Sweat itself is not dirty, but it can mix with oil and residue and contribute to congestion if left too long. Your environment matters as well. In humid climates, oil and sweat can increase, and sunscreen can feel heavier. In that setting, night cleansing becomes even more important, and lightweight layers often work best. In dry climates or heavily air-conditioned environments, the barrier can dry out more easily, and you may need a richer moisturizer and a reduced frequency of active ingredients. Your routine should respond to your skin signals. If you suddenly feel tightness and stinging, reduce actives and prioritize barrier support until your skin feels calm again. Diet and lifestyle can support blackhead prevention, but it is important to discuss this responsibly. There is no single food that causes blackheads in everyone. Skin is influenced by genetics, hormones, stress, climate, products, and overall health. Some people notice that diets high in refined carbohydrates and sugary drinks correlate with worse acne. Some people notice dairy triggers. If you suspect a link, a calm experiment is more helpful than extreme restriction. Change one factor for several weeks and observe. Also remember basics: sleep, hydration, and stress management matter because they influence hormones, inflammation, and habits like face touching and picking. When you are sleep deprived and stressed, your skin can be more reactive, and you may be more likely to overtreat or pick at pores. Prevention works best when your routines are steady and gentle. Hormones play a significant role in acne patterns, especially around the chin and jawline. If you notice cyclic flares, persistent congestion, or deeper breakouts, over-the-counter prevention can help, but you may need professional guidance for the best results. If acne is painful, scarring, or affecting your quality of life, it is reasonable to consult a dermatologist. Early treatment can reduce the risk of long-term marks and texture changes. Now let's talk about how to introduce products safely so you do not accidentally sabotage your barrier. Introduce only one new product at a time. Give it at least 2 to 3 weeks before adding another active. Patch test if you have sensitive skin by applying the product to a small area for several nights and watching for strong irritation. With salicylic acid, start at 2 nights per week. With retinoids, start at 1 night per week. If you experience irritation, burning, persistent redness, significant peeling, pause the active and focus on cleansing and moisturizing only until your skin feels comfortable again. Then restart at a lower frequency. This is how you stay consistent without turning skincare into a battle. Many people ask about clay masks and whether they help blackheads. Clay masks can temporarily reduce surface oil and improve the look of pores, especially in the T-zone. They are optional. If you use one, start once per week. Do not leave it on until it becomes painfully tight and cracked. Rinse earlier and moisturize afterward. Overuse can dry the skin and trigger rebound oiliness and irritation. Think of clay masks as an occasional oil control tool, not the foundation of prevention. If you also get inflamed pimples along with blackheads, you may hear about benzoyl peroxide. Benzoyl peroxide is primarily useful for inflammatory acne because it reduces acne-causing bacteria and inflammation. It is not the main ingredient for blackheads, but it can be part of a plan if you have mixed acne. If you use it, introduce slowly and do not stack it aggressively with other irritating actives. Moisturize well, and remember that benzoyl peroxide can bleach fabrics, so let it dry fully and be careful with towels and pillowcases. Let's also cover a practical, realistic 4-week starter plan that many people can tolerate. In week 1 and week 2, keep the routine basic. Morning, gentle cleanse or rinse, moisturize if needed, sunscreen. Night, thorough cleanse, moisturizer. Add a leave-on salicylic acid product only 2 nights per week. On the other nights, do cleanser and moisturizer only. In week 3 and week 4, if your skin feels comfortable, increase salicylic acid to 3 nights per week. If you want to use a retinoid instead, keep salicylic acid at 2 nights per week and add a retinoid 1 night per week, then slowly build. The key is not to add multiple new actives at once. Your skin needs time to adjust, and your results depend on consistency, not speed. Now let's talk about what success looks like so you do not get discouraged. Healthy skin has pores. Many people still have some visible dots on the nose because sebaceous filaments are normal. The goal is fewer new blackheads forming, smoother texture, less roughness in the T-zone, and pores that look cleaner and less congested. Often makeup sits better and skin looks more even. Progress is measured over weeks, not days. If you expect perfection in a week, you may overtreat and trigger irritation. If you aim for gradual improvement, you are more likely to succeed. There is also the question of pore size. People often say they want to shrink their pores. Pores do not open and close like doors. Genetics influences pore size, and oil production influences pore visibility. What you can do is reduce the look of pores by keeping them clear and reducing shine and inflammation. When congestion decreases and the surrounding skin is calm, pores look smaller and smoother. Retinoids and consistent pore care can help improve texture over time, but you should think in terms of improving appearance rather than permanently changing anatomy. Professional care can complement prevention if blackheads are very stubborn. A trained professional can perform safe come-down extraction, and a dermatologist can recommend treatments that go beyond over-the-counter care when appropriate. Professional extraction is controlled and designed to minimize trauma. It is not the same as aggressive squeezing at home. Dermatologists can also assess whether what you think are blackheads might be something else, such as milia or other types of bumps, and they can treat underlying patterns like hormonal acne. Finally, let me give you the most important mindset for blackhead prevention: calm beats aggressive. The routine that works is the routine you can repeat consistently without irritation. Cleanse gently and thoroughly, especially at night. Use one targeted ingredient at a time, starting slowly, such as salicylic acid and/or a retinoid, depending on your skin tolerance and personal situation. Moisturize to support the barrier so your skin sheds normally and tolerates actives. Wear sunscreen daily so your skin stays resilient and less reactive. Watch for hidden triggers like heavy hair products near the hairline, incomplete makeup removal, friction from masks, and stress-driven face touching. Give your routine time to work, and adjust slowly. If you follow this approach, many people see a meaningful reduction in blackheads and smoother skin texture over time. If your acne is persistent, painful, scarring, or not responding, professional guidance can help you get faster, safer results. The long-term goal is not flawless skin under a magnifying mirror. The long-term goal is healthy, comfortable skin with fewer clogs, fewer